So my name's Colleen Van Loon, and I've participated in the Libraries as Community Hub. So it's a collaboration to support the mental wellness. So the partnership is between CMHA, the Canadian Mental Health Organization here in London, and the London Public Library. And its purpose is to develop a community wellness hub model in London, which supports wellness across the lifespan and, in turn, greater community vitality. So the objective of this grant is to evaluate a pilot application of that model with a focus on processes and outputs. As a university community partnership, the co-investigators will also assist the CMHA team in developing their evaluation skills in order to look at long-term outcomes for the model itself. Therefore, short-term objectives include development of a new research partnership between Western University researchers and CMHA Middlesex, enhancing data collection and evaluation of CMHA and London Public Library staff and leadership, including through a salary research allowance. Completion of a comprehensive evaluation of the Community Wellness Hub pilot with a focus on processes and outputs. Training of undergraduate and graduate students in program evaluation research. So the evaluation of the Community Wellness Hub pilot will provide information both locally as a CMHA and London Public Library consider further collaboration across library sites, as well as to libraries nationally as they struggle with serving patrons with complex needs. So the methods that we've approached with are mixed methods, which include qualitative and quantitative. So currently we're doing a patron survey, which is... So it's a 7-question survey, and some of the questions include: how would you rate your overall experience of talking with the Community Wellness Hub staff? How well did the Community Wellness program meet your needs today? Were you satisfied with the location of the hub itself, situated inside Central Library? How likely are you to approach the staff again? Overall, how satisfied or dissatisfied are you with the services? So currently we are in the preliminary stage. So we have completed just over 30 interviews. And the interviews have been completed with patrons themselves who have used the hub, as well as library staffs and key informants. So currently we're finding that the overall patron survey has shown a high likelihood of participation and engagement and in favor of the hub itself. Some of the downfalls or the limitations was the issue of privacy. So currently the hub is situated on the 2nd floor, so it doesn't offer a lot of privacy when individuals are discussing some serious mental health concerns. But some of the other preliminary findings, which I think we can really reflect on, was a lot of individuals, patrons themselves, they inform the interviewers that the library is a place to call home. A lot of individuals that do use the services are currently staying in shelter. So they find it, more of a warming place after being shuffled out of the shelter at 9 a.m. So, it's also a space where people check into to meet friends. There's a large satisfaction amongst the security staff and the library staff for having the Community Wellness Hub in there. It's only there 1 day a week, so something that they did mention is that they would like to see this expanded throughout the week itself, having staff there throughout the library hours. Again, and the library staff did mention that they're not trained to accommodate such individuals with high complex needs. So that's, again, another thing that we can expand on in the future. A lot of individuals express that the library is a safe place. And again, it's a place where it's out of the cold and a place where they do call home. The library staff definitely overemphasize the need for more social supports within the library itself. As we see an increase in drugs, crime, and shelter use within our city, this is another factor that the library staff and key informants have expressed. And it's a place for families or friends to obtain information, as well as a referral source. So they're looking at the Community Wellness Hub to provide that key referral source for individuals that are in need. And it's also a diversion from police as well as security. And it's also for a lot of individuals that do already partake in CMHA programs, it's also really important for them to just come in and speak with the staff at the CMH Hub just to check in on their mental wellness, which I think is really important. So overall, currently the analysis looks very positive. the library staff, they're overwhelming with positive positive comments toward the staff there, and they're all really getting along. And now we're looking forward on how can we expand this within the London context, and what other supports are needed. So it's really like, we're just divulging, but there's so much more that I think is going to come out of the analysis once we're done with how we can expand this. So it's a really great project that I've been a part of. So thank you.